Welcome back everyone to part 2 of Cosmetic Gums with my specialist periodontist, Dr. Mitul Shah, the legend. So last time we were speaking about gum recession and talking about what it is, what causes it and what you can do about it. But this one is a little bit more interesting in some ways because we get so many clients asking about this. Because even though people have gum showing on smiling, which they're curious to get rid of, but Dr. Mitul is going to go through a step-by-step today. I'm going to do my usual, ask him about what a gummy smile is or what causes a gummy smile, and also talk about the various treatments which he's going to go into step by step. Without further ado, Mitul, what is a gummy smile? What is the scientific term for a gummy smile, by the way?
Not really a scientific subject, but essentially if you show any amount of gum tissue when smiling, it's technically a gummy smile. We know that there's sort of a pleasurable or a nice aesthetic appearance. We show 2 to 4 millimeters of gum when smiling, and that looks nice, and the gums sort of frame the teeth really nicely.
Just to stop you there as well, I did my video on the most desired smiles in the world, including Angelina Jolie, Julia Roberts and Margot Robbie, and they show about that amount of gum on smiling. Again, not a big deal. I don't show any gum, doesn't mean that I'm suffering in life. That's just what the textbooks tend to say.
If 2 to 4 is what we say is desirable, anything above 4 may be considered by people to be excessive.
And I do love some gummy smiles out there, by the way, and I love gaps and I love crowding, so there is not one size fits all.
Yeah, and really when we sort of look at a patient, we take a holistic approach, so we want to make sure that everything about you're happy with, the smile, the frame, the gums, everything there. And if you're really happy about having a diastema or showing some gum, we're not going to change that. On the other hand, if you're complaining and you think, oh god, my teeth look really tiny, they don't seem to suit my face, I show too much gum, then that's really where we can kind of help them.
For me, it's really important though, and we have a really amazing case that we did together where people come in requesting cosmetic treatment, for example veneers or bonding, and their teeth are actually really small in height and they need the gums adjusted in some way. Here's a photo of the case that we treated together. Patient came in and she requested veneers. I said to her, look, you actually need gum removed because your teeth are really small in proportion. Suppose, actually, before I ask you that, what are the causes of excess gum showing?
There's no one cause, but you can break it down into a few factors. One is sort of the skeleton, then it's the soft tissues, then it's the gums. So in terms of the skeleton, it's to do with the height of the top jaw. So some people can have a normal sized maxilla, some people can have what's called vertical maxillary excess, so literally the jaw is bigger. And if you have a bigger jaw, you're going to have more gum and the potential for more gum to show when smiling. Soft tissue wise, it comes down to the lips. We all have muscles that control our lips, and our lips have a certain tone. Some people have lips that fall quite low on the teeth, and even when they smile, the lips don't move very much. Other people, especially younger people, have much more muscle tone in the lips. And that in combination with the anatomy of the top jaw means when they smile, there's the potential for the lip to rise up quite a lot, which we call a hypermobile lip. Finally, it boils down to the gums and the teeth. Sometimes people can have short teeth as a result of wearing teeth down. If you've had a lot of fizzy drinks, you grind your teeth, the teeth will naturally become shorter. But actually there's an anatomical condition called altered passive eruption, which essentially means that the full extent of the crown, which is where the enamel is, hasn't been exposed.
But if somebody, and I've had some clients come to me with this issue, they say, I feel like I'm showing too much gum on smiling, but the proportion of their teeth, i.e. their teeth are the correct size. What causes that?
So that will be much more to do with the first two things that we said, which is the skeleton or vertical maxillary excess, or the tone and movement of the lips. Crown lengthening, which is where we're trying to actually make the teeth bigger, will have a negative impact on the smile. We don't want to make teeth excessively long or out of proportion. Treatment of those cases is a combined effort. So sometimes it can involve maybe some orthodontics. Maybe we'll actually try and push the teeth higher up into the jawbone. Maybe we'll be doing some soft tissue surgery on the lips to change the position of the lips and how the lip moves. Possibly for these cases, you're looking into sort of more extensive surgery, so orthognathic surgery with a maxillofacial surgeon, or possibly seeing a plastic surgeon to address the lip issues as well.
Now we're going to go through the step by step for the treatment of altered passive eruption. So assuming somebody has excess gum and small teeth, what are the options available?
So there's two types of treatment. The one that most patients will research is something called a gingivectomy, which simply means removing gum. And we typically do this in very small cases. So let's say we're trying to increase the height of the tooth by 0.5 millimeter to 1 millimeter.
Yeah.
Or in cases where the issue is not so much altered passive eruption, but it's simply overgrowth of the gum tissue.
Yeah.
Gingivectomy can be performed with normal sort of surgical techniques, but most commonly with lasers. So
Yeah.
lots of dentists have lasers, and they can very painlessly, with a little bit of local anesthetic, just recontour the shapes of the gums.
And it cauterizes when it cuts, which means that you don't have excess bleeding or anything
Don't
like
need
that.
stitches.
Minimal downtime.
In cases where the issue is not so much the gum, but it's actually the foundation, the bone, and the bone is in the wrong position, if we just address the gum, so we just trim the gum, all that would happen is within a matter of months, the gum would grow back, because in health, there has to be this gap, which we call the biologic width, which is this distance of 3 millimeters between the bone and the gum.
Yeah.
If we don't have that distance, the gum will regrow to recreate it. So in those cases, what we actually have to do is a sort of a slightly more invasive surgery called crown lengthening. This still involves reshaping the gum tissue, but at the same time, we're going to recontour the bone around the teeth to ensure the gum doesn't grow back.
Talk me through, so if somebody's coming in for crown lengthening, when they come into you for a consultation, what usually happens?
So we always begin with a detailed history of, your medical health, your dental health, and really trying to get to the bottom of what you like and dislike about your teeth, because ultimately we're going to recommend things that are going to make a difference to you. We then do a really thorough clinical examination, and we assess all of those factors that contribute to a gummy smile. So we look at the height of your top jaw, we look at the tone of your lips, we look at how much gum you show when you smile. We take clinical photos that we can show you to kind of plan and explain in sort of clear detail what the issues are. We then look inside your mouth, check that there's no decay, everything's okay. I will take measurements of the heights of all of the teeth. Usually we do this with calipers to make sure we're really, really accurate. Once we've done that, I actually kind of sort of stop for a moment and talk to the patient and sort of say, okay, so we've established that your teeth are a little bit too small.
Yeah.
What is the right height of the teeth? And they sort of look a bit puzzled at me like, I don't know. We use this tool, and there's a picture of it here, called a proportion gauge. What we know in terms of aesthetics and what looks good, it boils down to two things: proportion and symmetry. Proportion, when you talk about teeth, is all to do with the height to width ratio. So really simply, you want your teeth to be slightly taller than it is wider. If the teeth are pretty equal in height and width, the teeth look too square, it's very masculine, and it's sort of a less desirable appearance. So by using a proportion gauge against the teeth, we can sort of say, look, your tooth is this wide, this would be a good height at the end of it all. We can actually work out how big your tooth actually is. So if you have altered passive eruption, you have some teeth hiding underneath the gum, we can take special x-rays to calculate how tall your tooth actually is. This ensures that if we do any surgery, all we're doing is exposing the enamel and not going onto the root surface, which is a bit darker. In more complicated cases, especially in ones where people don't want bonding, they don't want veneers, they just want the full extent of their tooth to be shown, we can actually take a CT scan to really accurately assess the height of all the teeth.
Mitul and I do facially driven treatment, so we look at somebody's face as a whole and decide together how the patient will look and needs to look. And we do have something else which is super cool to show you what the treatment is going to look like before you've even started, and that is
smile design. This comprises of two things. So one is digital smile design. Using the photos we've taken, we will try to simulate the end result of crown lengthening, so how tall your tooth is going to be after having crown lengthening. At the same time, we take a scan of your teeth and we get something called a wax up. It's a trial smile. Essentially, we're mocking up how things are going to look after crown lengthening and after possibly bonding or veneers. So we will have two models, one of the teeth before and one of the teeth after the treatment. So you could visualize the changes before we actually commit to doing anything. If you like the appearance of the wax up and you're in agreement, we can then move on to kind of planning for the surgery. And to ensure we're kind of as accurate as possible, we'll do things in a guided manner. So what we'll do is create a stent, something called a crown lengthening stent, based on the wax up, based on the CT scan, which ensures that the result that you were shown on the model is the exact result you're going to get when we do the surgery. So nothing's left to error.
And then what happens on the day of surgery?
We call it surgery, but to be honest, it's not that big a deal. Don't worry, don't panic. It's done under local anesthetic most of the time. If you're particularly nervous, we can arrange for sedation. Eat and drink normally before. We'll give you some painkillers, usually paracetamol, ibuprofen. We'll numb you up, so during the surgery you feel absolutely nothing. I usually tell people to bring some headphones, listen to a good podcast, or some nice music. or you can listen to my terrible choice of music on my speakers. The surgery itself, you don't feel any pain. The first part, we trim the gums. The second part, if necessary, we readjust the bone, then we'll place some stitches. Stitches always kind of frowned upon by people. They don't want them to be there, but I try to make the stitches as invisible as possible. I'll try my best to basically hide the stitches behind the teeth so you don't really see anything when you're smiling.
I think we have a picture here to see, so you can see how discreet it is.
We'll sort of stop at the very end, make sure that you're happy and go through all the instructions. After surgery, to be honest, you can pretty much go back to work the following day. As long as you're taking painkillers, you're following the instructions, the downtime is really low. Most people will only take painkillers for the first 3 days. In terms of diet, you do have to follow a bit of a soft diet. That doesn't mean soup or just complete liquids, but things like pasta, chicken, fish, steamed vegetables, all okay. Things to avoid are sort of hard, crunchy things, so biting into apples. We leave the stitches for 2 weeks. The stitches are removed. We don't need to numb you up for that. It's pretty painless. And once the stitches are removed, really we can begin sort of getting you brushing again and letting things heal sufficiently so you can then go on to have bonding veneers, or in some cases nothing.
And how long do we have to usually wait before we can do what I call the restorative treatment, which is the stuff like veneers or bonding?
Varies. The earliest the quickest time is 6 weeks from the day of surgery. It can be as long as 4 months. It really depends on how things are healing and the characteristics of your gums. And we don't want to commit too early to veneers only to find that the gum has changed position. So by waiting in some cases, we ensure that we're really happy with the gum position, the shape, the symmetry, the contour, everything is perfect. Very rarely, if there are some slight areas of asymmetry, we can easily correct those with some minor contouring with the laser. It's worth kind of waiting until we kind of commit to the veneers, so that's perfect.
Some people have decided not to go for the bonding and veneers, and that's absolutely fine, music to my ears, because less is more. So when they're happy with just having the gum surgery, which is something that lasts forever, you don't need to have the other treatments, which is super great.
A lot of the patients we see at Chelsea have often had gum work done elsewhere. So they'll sort of say, I had contouring, but my gum grew back. The key thing is to make sure that you are seeing someone who is trained appropriately and understands the anatomy and the problem so that they offer the right treatment. So for example, I will do laser gum contouring, but only when it's going to work. There's no point doing that if the right treatment is proper crown lengthening surgery.
I think people get scared because they're like, oh, bone removal, stitches, surgery, but it's not like that. And you have to think actually getting it done properly is going to be better, because if not enough gum is removed and you have bonding or veneers, you have this problem that Mitul's talked about, which is invasion of the biological width, which means that the gums can overgrow onto the veneers and bonding, and things will look inflamed and angry, and it's not the right treatment to do. So sometimes you do have to go that step further. He's super gentle and wonderful. I know I'm being biased, but he is. If it's the proper thing to do, get that done. Don't just go for the gum laser just because you think it's less invasive, because it might not be the right thing for you. We all know now in detail about what to do if you have excess gum showing according to what the textbook says. If you're happy, absolutely fine, but you've got your options, and we've done a step-by-step treatment so you know what you're in for when you come into Chelsea Dental Clinic. If you need anything, contact either of us on Instagram. Here's our handles and you can find us on there. So have a great day everyone, and see you soon.
Bye.